Good evening to all. Welcome to the 161st day of the Swasthya 365 days project. Today we are going to see about the treatment and diagnosis of the encephalitis. Diagnosis of encephalitis is made after sudden or gradual onset of specific symptom and after diagnostic testing. During examination, your doctor obtains a complete medical history, including a immunization history. Your doctor may also ask if you have recently had a cold or other respiratory illness or gastrointestinal illness, and if you have recently have a tick bite. Have been around pets or other animals or have traveled to certain areas of countries. Diagnostic tests that may be performed to confirm the diagnosis are the following. First is magnetic resonance imaging, that's called as MRI. A diagnostic procedure that uses a combination of large magnets and radio frequencies and a computer to produce detailed images of the organs and structures within the body. Next is computer tomography, or called as CT scan or CAT scan. A diagnostic imaging or procedure that uses a combination of X-rays and computer technology to produce horizontal axial often slices of the body. A CT scan shows detailed images of any part, including bones, muscles, fat, and organs. CT scans are most detailed and general than general X-ray scans. Blood test, urine and stool analysis, sputum culture. A diagnostic test performed on the material that is coughed up from the lungs and into the mouth. The sputum culture is often performed to determine whether infection is present. Electroencephalogram, a procedure that records the brain's electrical activity by means of electrodes attached to the scalp. Spinal tap, also called as a lumbar puncture. A special needle is placed in the lower back into the spinal canal, the area around the spinal cord. The pressure in the spinal canal and brain can be measured. A small amount of cerebrospinal fluid, which is a fluid which in turn runs over your neural system, can be removed and sent for testing to determine whether there is an infection or any other problem. CSF is a fluid that bathes the brain and spinal cord. A brain biopsy, a procedure performed to remove the tissue or cells from the body for examination under a microscope. In rare cases, the biopsy of an affected brain tissue may be removed for diagnosis. This is called an histopathological study. Intercranial pressure monitoring, that's called as ICP, measures the pressure inside the child's skull. If there's a severe brain injury or head surgery, brain infection or any other problems, the brain may swell. Since the brain is covered by the skull, there's a small amount of room left for it to swell. This means that brain swells, the pressure inside the skull goes up, and the pressure is significantly higher than the normal. It can cause damage to the brain. People who have hydrocephalus or brain tumors may also have intracranial pressure to be monitored. The intracranial pressure is measured in two ways. One way is to place a small hollow catheter in the fluid spaced in the brain ventricle. Or other times a hollow device blood is placed to the skull into the space between the skull and the brain. Both devices are inserted by a doctor in the intensive care unit or the operating room. The ICP device is the intern attached to the monitor, which gives a constant reading of the pressure inside the skull. If the pressure goes up, it can be treated in the right way. While ICP device is placed, you will be given in medication, stay comfortable. When the swelling has gone down, there's little chance for more swelling and the device can be removed. Treatment of encephalitis. Specific treatment of encephalitis may be determined by your doctor based upon your age, overall health and the medical history. Extent of condition, your tolerance to specific medications, procedures or therapies, expectation of the course of the condition, your opinion or preference. The key to treating encephalitis is early detection and treatment. A person with encephalitis requires immediate hospitalization and close monitoring. A goal of treatment is to reduce the swelling of the head and to prevent the other related complications. Medications to control the infection, seizure, fever or other conditions may be used. Extent of this problem is dependent upon the severity of the encephalitis and the presence of the other organ system problems that could affect the person. In severe cases, breathing machine may be required to help the patient to breathe easier. As you recover, physical, occupational and speech therapies may be necessary to help to regain the muscle strength or speech skills. Healthcare team educates the family after hospitalization on how to best care the patient at home and outlines of specific clinical problems that could require immediate medical attention by his or her doctor. A person with encephalitis requires frequent medical evaluation following hospitalizations. Now coming to the complication of this disease. Majority of the patients who have encephalitis go on to have at least one complication, especially elderly patients, those who have symptoms of coma and individuals who did not receive a treatment at an early stage. Complications may include loss of memory, especially among these who had herpes simplex virus encephalitis, behavior or personality changes such as mood swings, bouts of frustration and anger, anxiety. Sometimes it can lead to epilepsy also, aphasia, a language and speech problems. Now coming on to the prognosis of the encephalitis after the treatment. Most children completely recover from the viral encephalitis, although prognosis depends upon the severity of the illness, cost of organism, and the age of the child. Potential deficits: intellectual, motor, psychiatric, epileptic, visual, or auditory in nature. 10% of the children younger than 2 years of age with enteroviral CNS infection suffers acute complications such as seizures, increased ICP, coma. Almost all have favorable long-term neurological outcomes. Now coming on to the prevention of encephalitis: effective viral vaccines, control of insect vector, eradication of disease breeding sites, insect repellents. Thank you.